Hello, everyone. So I wanted to talk about one of the things that made nursing school more of a challenge for me, and especially for those out there who may have had a similar experience or who also struggle with school. My message is that there's obviously hope, that there is a possibility for you to lead a full and fulfilling life. So with that, I'll begin. And I'll try to explain some of the medical terminology if it comes up. So when in 2012, when I was 22 years old, I was riding my bike to campus and my heart stopped. And it stopped for 5 or 6 minutes before first responders arrived on scene. I was cyanotic, blue in the extremities, so lips and fingers were blue, meaning that my body lacked oxygen. So my heart had stopped. And from there, first responders revived me on scene, got my heart beating on scene. And then I coded 4 more times in the ambulance on the way to the hospital, which was up the street. And coded means heart stops, gets into an arrhythmia and stops. So they engage in CPR. Then when they get a rhythm again, then they'll shock you to get normal sinus rhythm, which is the normal beating of the heart. This was obviously traumatic. It's considered a traumatic brain injury because my brain lacked oxygen for a period of time. And when I was at the hospital, they put me into a medically induced coma. Keep in mind, I was not awake during any of this, but they put you in a medically induced coma to put you into an ice bath because they don't want you waking up in an ice bath because it's obviously very uncomfortable and it's a shock to the system. So you're heavily medicated while you're in an ice bath. So they put me into an ice bath to try to save brain function. Because there was some research pointing that if you immediately following a traumatic brain injury, a cyanotic traumatic brain injury, that's when the brain lacks oxygen. So it wasn't that I was in a car crash or anything or even falling over. That wasn't a traumatic brain injury. It was the fact my brain lacked oxygen for that long. That was what was traumatic about the brain injury. So they put me into an ice bath to save brain function. But then I never woke up. And it was a period of 2.5 weeks where the head of the neurology department at the hospital that I was at in Lansing, Michigan, said that I was brain dead and that at best I'd be able to sit up and feed myself maybe one day, so pull the plug. And that he's never wrong. And so that was obviously very traumatic on my family, my friends, my mom especially, because she was a single mom, always took care of me growing up. And she was convinced that I was still there, but the neurologist just kept hammering home that like I wasn't there, there wasn't a me inside of me anymore, and that it was best to pull the plug to think of quality of life. So on the day they were going to pull the plug is when I woke up and I started responding. And first it was nurses around my bedside. And when my mom got to the hospital that night, because they were going to pull the plug the next day, so she went home to get some sleep for the first time in a long time, because she'd kind of given up. She came back to the hospital and there was a bunch of nurses around my bedside, and she thought that she'd gone home to get some sleep and that I died overnight. But some nurses ran out and were screaming like, he's there, he's responding to us. We don't care what the neurologist said, he's there. And so I was cognizant, I was awake and present. So they said, so she was like, we're not pulling the plug, obviously. And then it was within a few days following that I was taken off of life support, and started a fairly quick physical path to recovery. But they didn't know what was wrong with me, what had caused my heart to stop. So they ran some tests, and it turns out I had something called L-kappa, which is anomalous left coronary artery from the pulmonary artery. And what that means is that your coronary artery is the blood supply of oxygenated blood to the heart. So instead of attaching to the aorta, which carries oxygenated blood to the rest of the body and should carry oxygenated blood to the heart, my coronary artery attached to my pulmonary artery, and my left coronary artery attached to the pulmonary artery instead of the aorta. And so your pulmonary artery carries unoxygenated blood to the lungs, or deoxygenated blood to the lungs. So it doesn't completely lack oxygen. There's still some oxygen there, but it carries that deoxygenated blood to the lungs so that it can become oxygenated again and then brought back to the heart and then pumped out through the rest of the body. So what that meant is I grew up with not enough oxygen on the left side of my heart. So if a heart attack is when a portion of your heart lacks oxygen, right? Usually it's because it's got a plug, something like that. So like fatty deposits build up, that sort of thing, that leads to a heart attack. But with me, my heart just always lacked enough oxygen there. And so it's only 1 in every 300,000 live births has Al Kappa. So it's a very rare birth defect. And as a result, they don't test for it, which you could do a basic sonogram on the heart, checking out like the physical structures, and it's very clear that it's misconnected. And I grew up with chest pain, angina. That chest pain was usually around physical activity, like cardio activity. Anytime my heart rate got to a certain point, it'd start to hurt. And when that would happen, I would stop what I was doing. So you know how they tell kids like push through the pain, whatever. But growing up, I didn't push through the pain because I was like, well, this hurts and I'm gonna stop. So the feedback loop was, oh, I'm in pain now, I'm just going to stop. And as a result, and through a combination of, I actually found that if I burped, which releases pressure, so I would build up pressure artificially in the chest and then release it by burping, that helped my heart condition. It helped me get back into a normal sinus rhythm, normal heart rhythm. But so that was why I went down in the first place. But I had this traumatic brain injury as a result of my brain being oxygen starved for so long. But the physical path to recovery was fairly quick. It was, so once again, I went down. 2 weeks later, I woke up in the hospital, and then about a week or so after that, I had finished physical therapy because my muscles had atrophied in a coma, right? You're not moving around, it's very different than being a couch potato. You're literally not moving. You're not moving any muscle really in your body. And you can offset it a little bit by moving the arms, moving somebody's arms, moving somebody's legs when they're in a coma. But overall, my muscles had atrophied, and that made it hard to walk, made it hard to do regular physical activity or regular things like brushing your teeth even. So I was in physical therapy for that, as well as behavioral therapy, I believe is what they called it, something like that, where you relearn to do the normal daily activities like showering, brushing your teeth, writing, that sort of stuff. So it was a fairly quick physical recovery. I graduated from physical therapy in like a week and a half. And they actually wanted to do a bypass on me and install a defibrillator, which were all completely unnecessary. The standard practice is just to correct the birth defect, and that's all you have to do. But because it's such a rare heart condition, birth defect, there's only one surgeon in all of North America who had ever performed it. And his name was Dr. Beauvais, and he was located in Ann Arbor, Michigan, at their pediatric cardiac care center down in Ann Arbor, connected to the university. It's a very good hospital. One of the best that I've ever been in my life. It was a tremendous experience, really great. Absolutely loved every second there. Everyone was super professional, super nice. And it was a big change of pace from the hospital I was at in Lansing, which the running saying is you go there to die. The medical professionals in Michigan view this hospital as a place that you go to die because it has very poor patient care and very poor patient care practices at the hospital. So I was very lucky that it was such a rare birth defect that he actually, and the surgery was so pressing of a need because they didn't know when I would go down again, that he actually cleared his schedule, and I went into Mott's Children's Hospital on a Friday, and I had heart surgery on a Monday, that next Monday. So it was really fast turnover, and from after the open heart, I recovered very, very quickly physically. Keep in mind, this was my senior year of college, and I had just switched majors from religious studies to criminal justice. So I had 30 credits of criminal justice plus some extra college requirements because I switched colleges to the College of Social Science from the College of Arts and Letters. So I had a lot of classes that I still had to take, but this was my senior year, and so physically I recovered very, very fast. I went back to the gym 2 weeks after open heart, not doing cardio activity, but weight training, which is something that I loved. And that was very fast physical recovery. And because no one my age had open heart, they didn't have any data. So they're like, well, you're the data set. We don't know how fast it will take you to physically recover. And so however long it's taking you is the average for how long it takes to recover physically from open heart at the age of 22, because usually open heart occurs in the very young for these birth defects, or the very old, people over the age of 60, 65, 70, because degenerative illness that they've had that have led them to a need to have open heart surgery. So they didn't have data on people my age, and so they kind of let me guide my own physical recovery. And they had told me that it would take me about a year before I went back to school to recover cognitively from my past experience. But instead I went back to school immediately. I still had to finish my summer classes, which weren't terribly difficult, but these are the introductory classes in criminal justice, that sort of thing. So I was finishing up some of these classes, and I was very lucky that the school worked with me very well in terms of accommodating my issues related to the cognitive deficit that I was now in. But I really went from 0 to 100 very, very quickly. But there was still a deficit. I was down. My brain lacked oxygen for at least 6 minutes. Normally, people are dead. That's not an exaggeration. It's not a lie. I was without oxygen for an extended period of time because when I had collapsed, I collapsed because my heart stopped because it got out of rhythm. And when your heart gets out of rhythm like that, it can stop, and my heart stopped, and that's why I collapsed. So from the point that I went down to the point that the first responder arrived on scene, it was at least 6 minutes, because you have to factor in, it took people to realize that I was down. I was a bicyclist. They didn't know what had happened. It took people a little while to realize, okay, this person's lying on the ground. What's going on? Go over to me. Are you awake? Are you awake? What's going on? For them to then call an ambulance, and for a first responder to arrive on scene who wasn't even a police officer. It wasn't a police officer or paramedic that arrived first on scene. It was a guy who had a former police officer from the city of Lansing who had a CB radio in his vehicle and heard that there was a bicyclist down at this intersection. And so he drove his car at normal speeds to get to me. And he was at least about 1.5 miles away and driving through traffic, which there was traffic at the time. So I was down for a substantial period of time, and every second that your brain lacks oxygen, there is trauma. There's going to be a deficit, and I was lucky that I was young. And in those that are young, through neuroelasticity, it's a lot easier for them to recover than if I'd been 45, 50, 60 years old. But overall, I was still operating at a deficit compared to what I was before. And so if I wanted to finish school, I had to work a lot harder to get the grades that I used to be able to get relatively easily. I was always a good student. I always studied very well, but I could read something once and retain it. Whereas now it takes me 2 to 3 times reading it to retain it. I developed kind of other study techniques to help me get through it. But overall, it was still an uphill climb to try to do well in school every semester to graduate on time. And I was very lucky that I was. And because of my commitment to my schooling and my determination to recover, I actually made Dean's List every semester after the incident. Because I tried very hard. And over time, the deficit got a little better. At first, I had a speech impediment when I first woke up. And now, through concentration, I can speak clearly. But that's still present. If I get very tired, if I'm really fatigued, I develop a slight lisp. But overall, I've been able to overcome that as well as other bits of the cognitive deficit, but it's still really hard for me to learn. So from there, I ended up going to grad school later on in criminal justice. But at the end of the day, I couldn't find a job in my field. I'm openly gay and have been since I was 16 years old. And the criminal justice field isn't a very friendly field still to gay men. And as a result, and I went into criminal justice because I wanted to help people. I wanted to do something to affect change in my community for the better. And the reason why I didn't go into nursing is because I felt like I was bad at math, so I couldn't do it. Well, I moved to Chicago with a job offer that was rescinded because I had 2 master's degrees and the job paid $14 an hour. And so they figured that I was only using it as a stepping stone to move on to a job that paid more later on down the road, which, although accurate, you are paying, $15 an hour and requiring a bachelor's degree. So it's kind of on you. So long story short, I decided to go try nursing school because I'd made a lot of friends in the healthcare field. I talked to them about whether it'd be wise to go, to try to pursue nursing, given my history, given my condition. And I especially have a friend here who's a neurologist, and he was able to kind of talk me through first, what it's like being in medicine and the math requirements and all that sort of stuff. So I was able to have some of my fears allayed a little bit. And so I decided to try it. And so I went back to school at the community college here in City Colleges here in Chicago. And I started taking the pre-required classes for me to go into the healthcare field, to go into nursing. And so those are 4 very standard ones are general chemistry, human anatomy and physiology 1 and 2. Sometimes it's human anatomy and sometimes human physiology, or anatomy and physiology as 2 separate classes. Sometimes they're lumped together, human anatomy and physiology 1 and then 2. And that's the way that they are here at City Colleges. And also microbiology. And they give you other choices for you to take, but for me, the simplest path forward was to take human anatomy, physiology 1 and 2, microbiology, and general chemistry. And to take general chemistry, you have to take intro to chem. And to take any biology class, you have to have a recent intro to biology class effectively. And so that's what I started to take. And I studied my butt off. I worked very hard. I amended the way that I study, and in later videos I'll talk about my study methods, especially if you're out there and you have a traumatic brain injury or you have difficulty studying in the first place or retaining information. Because for me, it's not a difficulty in studying, it's a difficulty in retaining the information. And so I can share with you my study habits and what I've done to kind of make up for this deficit that I operate under, and it's been very effective. And so I took those classes. So it started out last fall is when I started down this path. And so I took 2 classes the first term, and then I took 2 classes the second term. These are 4 or 5 credit classes. And overall, I started down this path really jumping head first in, and did well. And made the dean's list every semester like I did after my accident in the first place. And I was doing well in classes that I'd never done well in before. The hard sciences are ones that I'd taken. I'd done somewhat well, I'd done good, but I was always strongest in the social sciences and never as strong in the physical sciences, or especially human physiology, that sort of things. And then here I am getting A's and high B's, and I loved it. And I loved my classes and I did really well. And I applied to DePaul's Master's Entry to Nursing Practice program after reviewing what an ABSN was, reviewing what an Accelerated Bachelor's of Science of Nursing, ABSN, learning the growth in the nursing field and the growth in the requirement for a master's degree. A lot of hospitals nowadays are looking for nurses to have a master's. And so there's kind of this uptick in requirement. Before it was just an RN, which is usually connected to an associate level program, which is a 2-year undergrad below a bachelor's program, and then now BSN, now MSN. So there's the growth in requirements for nursing. And so I figured instead of spending a year and a half and getting an ABSN and then having to go back later to get a master's degree, which is another 2-year program, I could just go on to this master's entry to nursing practice program, get a master's straight off the bat, a master's of science in nursing straight off the bat, and then have that training and have that degree, and then I can go on from there to later a doctorate in nursing practice or become an advanced practice nurse, like a nurse practitioner or something like that, which would be down the road. So that was the path that I decided to take, and so I applied to DePaul and I got in, and I was super excited. I mean, my grades were very good and I had 2 masters already, so my chances were pretty high of getting in. But yeah, I got in and it's been an experience ever since. There's a lot more requirements than I could have ever thought on the part of the school and a part of the clinical sites that you're going to go to. And so I've been getting my blood drawn for titers. I've been getting booster vaccines when it comes back that I'm not immune to certain things that I should have been immune to, and so much more. Getting drug tests and getting all this. And so I'll review in another video all the steps for applying to this master's entry to nursing practice program, and steps once you've been accepted to continue your work in the master's entry program. So because it's a lot and it can seem overwhelming, but it's really not that overwhelming once you break it down. So I hope that my experience here by sharing my experience with my healthcare issues with you, you can better understand how your health outcomes might be a little different than what doctors have told you. So this is, obviously I'm not giving you medical advice, but what I am saying is this is my experience. This is what I have experienced, both in the healthcare setting as well as my recovery. And this is what I'm now doing, which is something that I never thought I could do even before my accident. So it's overall, I hope that you have a better understanding of what recovery is like with some traumatic brain injuries. I am an exception. I'm by no means the rule. But there is hope out there. If you've had a traumatic brain injury, or if you know someone that has had, if you have a family member or a friend who's had a traumatic brain injury, something where it's like a hypoxic brain injury where the brain has lacked oxygen, that there is hope. I'm not trying to give you false hope, because I'm a unique situation. Everyone is unique. Everyone's body is unique. The fact my body developed corollaries, which were basically capillaries that had developed and veins that had developed that brought oxygenated blood from other parts of the heart to the left side, that allowed me to stay alive for so long, right? That's very unusual. I'm one of maybe a handful of people who've lived past infancy with undiagnosed L kappa into their 20s, 30s. There's women who've been in their 50s or 60s, but I can't find evidence, and I tried looking in the medical journals for any male over the age of childhood who has survived with L kappa. So it's very, very rare, and it's a unique situation. It's a unique circumstance. So I just hope that by watching this, you have gained some insight and maybe learned a little bit more about the effects of traumatic brain injury, but also what you can do afterwards, after you've recovered, or what recovery might look like. So with that, I will leave it off. Have a good day.